Uh, Welcome back to our modules on looking at trauma and health. Today I'm going to actually talk about a little bit some of the perinatal factors that are actually helpful for trauma survivors. And particularly with one area that may not be necessarily obvious at first, but I think actually you'll find kind of interesting, and that is actually how breastfeeding can be helpful for trauma survivors. And I'm going to particularly talk about my research with sexual assault survivors. And again, this is often a group that people say, oh gosh, they're not going to want to breastfeed. Well, we'll see that that's actually not quite true. But let's take a look at kind of what are some of the factors. And again, like I said, we've really had a lot of interesting recent research on this, and it's opened up some kind of interesting areas of inquiry. Okay, so let's talk first a little bit about breastfeeding. What do we know in terms of what it does in terms of physiology, in terms of a mother's physiology? Now, this is assuming it's going well. I'm also a board-certified lactation consultant in addition to being a health psychologist. And believe me, I know all the many things that can go wrong with breastfeeding. I know that that's very stressful. But let's say the breastfeeding is going well. Okay, then we're going to actually start seeing that there's a number of benefits that the mothers gain from that. First of all is a down-regulation of the stress response. And that's something we've talked about in all the previous modules in terms of that kind of, oftentimes a lot of these health effects are due to a chronic upregulation of the stress response. Well, interestingly, breastfeeding actually turns that off. And that's actually one of the things. It's one of the things like exercise that helps. Exercise helps, omega-3s help, breastfeeding helps. Same reason. We know that it actually improves maternal mood. It actually helps with that. It decreases the risk of depression. And again, I particularly like to point out the Dennis article in Pediatrics in 2009, looking at 49 different studies and actually showing that. Also, it's kind of interesting, it decreases hostility. And as we've talked about in kind of previous modules, hostility is one of the things that actually, can cause a lot of the health problems. And also, too, we know that it improves the mother-infant bond. Okay, so let's talk a little bit about what it does in terms of that stress response. This was a study from Germany. I think this was kind of an interesting one. And they were actually looking at breastfeeding mothers, and they were comparing actually holding the baby. We get an oxytocin response from that. Holding the baby versus baby actually physically at the breast. And what they found is that holding the baby is good. Breastfeeding and actually having the baby at the breast is actually even better. And specifically, it decreases those stress hormones, ACTH and cortisol. Those are easily measured in the lab. And then when they tried to stress the moms after they had the baby at the breast, what they found is that it lowered the stress response to an induced stressor. So even when they wanted to stress them, they actually couldn't. And it's kind of like what the moms tell you. The world's falling apart, sit down and nurse the baby, it doesn't seem that bad. And again, if you think about it, there's a lot of survival advantage to that. It makes sense that, nature would sort of wire women's response. So there was actually, sort of a check and a balance because, the postpartum period is pretty vulnerable. And so here is something that helps kind of counter that. Okay, and so overall they concluded that suckling provided a short-term lessening of the stress response. And I would like to actually just mention the research of Maureen Brewer, who's really done a lot of the kind of groundbreaking work looking at kind of breastfeeding and that stress response. But we can think about it in terms of kind of being the flip side of the oxytocin response. Breastfeeding sort of upregulates that oxytocin response. And when the oxytocin response is upregulated, the stress response is downregulated. Okay, think about them as sort of flip sides of the same coin. Okay, so what do you get with the oxytocin response? Well, oxytocin is the feel-good hormone. So you get a lot of wonderful things. You get well-being, you get affiliation, you want to be around people. One of the things that releases oxytocin is sitting around the table having a good meal with family. I don't think it's any accident that all over the world we celebrate occasions with families and friends over a good meal. And so again, being out in the sun, we associate it with reproductive events, orgasm, we associate it with milk letdown, labor and delivery. But again, getting a massage, laying out and enjoying some nice warm sunshine, all of these things release oxytocin. And when oxytocin is up, you want to be around people. You want to trust people. You want to be with people. Kirsten Ufness-Moberg, who's done a lot of the research on this, actually she's done a lot of very creative studies, but one of the studies she did that I thought was kind of funny is she gave people oxytocin nasal spray, and it turned out that these people were more likely to say they'd loan her money, if they had some oxytocin. Oxytocin is kind of a good thing. Now, the stress response in contrast is really the opposite, and we're talking about when it's chronically upregulated. Chronically upregulated stress response, you get more depression, anxiety, you get alienation, you get hostility, and you get interpersonal strife. And what's actually really interesting is to take a look at kind of like, well, we know breastfeeding upregulates that oxytocin response, but do you see it doing things like decreasing hostility, increasing mother-infant bond? And the answer is yes. And we have really a nicely done study on this. This came out in 2009 in pediatrics. You can see big sample, 7,000 mother-infant pairs from Australia, 15-year cohort follow-up. And what they were looking at, it was substantiated cases of child maltreatment. Okay, and what they found was that breastfeeding decreased the risk of maternal perpetrated child maltreatment, okay, by a rather huge amount. Okay, so this is looking at physical abuse. Now these are odds ratios, which means an odds ratio of 1 means no increased risk. Okay, and so an odds ratio of 2.6 means that non-breastfed babies were 2.6 times more likely to be physically abused by their mother. Okay, and again, like I said, we kind of have some confidence given the, quality of the design in the large sample. And what was interesting is you also see this for neglect. Huge differences, almost a 4-time increase in neglect for the non-breastfed baby. And again, like I said, does this mean that somebody who's not breastfeeding is going to neglect their kid? No, not necessarily. But you've got these kind of built-in kind of things that nature has kind of provided, and they do seem to be protective. Okay, now the other thing that breastfeeding does is it actually improves sleep. This was an interesting paper that came out in the journal Sleep, and again, not a warm, fuzzy attachment parenting kind of journal at all, and yet finding that in fact poor sleep was a risk factor for depression. And again, I think there's been a lot of misunderstanding about where the role of breastfeeding is, because oftentimes mothers are told don't breastfeed at night, and then you're going to drop your risk for depression. Well, actually, it turns out the opposite's true. When you looked at the risk factors associated with poor sleep, there are a lot of things you'd expect. Depression, does terrible things to sleep. Previous sleep problems if the mother's a first-time mother. But what's interesting is take a look at this, not exclusively breastfeeding. Okay, in other words, the mothers who are supplementing are actually getting poorer sleep than the mothers who are exclusively breastfeeding. Okay, as I mentioned before, we've got 49 different studies at this point showing a decrease in the risk of depression for the exclusively breastfeeding mother. Okay, also too if they had a younger or male infant. Now, where this starts getting really interesting in terms of trauma survivors is to take a look at the impact of sexual assault and where breastfeeding fits into this picture. Now, as I mentioned before, oftentimes people think, when they see a population of sexual assault survivors, and this is something I've had a lot of conversations about over the years, because I'm a family violence researcher, so of course, as a lactation consultant for years and years and years, I've gotten all the questions about this. I've talked to hundreds of mothers about this. And oftentimes people think, oh, well, we don't want to tell them they have to breastfeed, or they're not going to want to. Well, first of all, we shouldn't assume. And for some mothers, that definitely is the right choice. We always have to go with what the mother wants to do. But I don't think we should assume, because I think the mothers actually, I've met so many mothers who wanted to. Now, it's not always easy for them. Okay, but I want you to take a look at this. When we ask them, are they breastfeeding, formula feeding, or mixed feeding? Okay, and take a look. This is the number that are exclusively breastfeeding. This is the women with no history of sexual assault, and this is the women with a history. Okay, and so these women were either reporting rape in childhood, okay, so in other words, the most serious kind of contact child sexual abuse, where it actually included penetration, or they were reporting rape as a teen or adult. Okay, so again, this is our most seriously affected. It's 994 women, and take a look at the percentage. It's exactly the same, 78% for both groups. Okay, so again, I think that this says don't assume. We don't know what the mom wants to do. We always need to ask her. Okay, now this is actually something that I thought was actually really interesting, because we had done a paper originally where we looked at the impact of feeding method on a lot of the sleep variables and depression variables and stuff. And I'd also looked at that separately for sexual abuse. And this one day I kind of put them together and I thought, I wonder what I'm going to find here. And what I found, actually, I have to tell you the truth, blew my mind. Take a look at this. Okay, and this is actually the pattern you're going to see in all the variables we're going to look at. Okay, now a very key variable in terms of predicting depression in new mothers. And again, this is based on our sample of 6,410 moms. Okay, but a very key variable is hours that they report that they sleep. And that's actually a better predictor than a quote objective measure of that. The more hours they report they sleep, the lower their risk for depression. Now what's interesting is, this is the exclusively breastfeeding mother here. Okay, and you do definitely see an impact of sexual assault. But take a look at our mixed and formula feeding mothers. Now this is the group that's either exclusively formula feeding or they're doing both. Now the reason we put them together is in previous analysis we discovered on every single variable there was no difference, so that's why they're together. But take a look at this difference. It's just huge. Okay, so basically, I'll tell you what I think we're seeing here. And this was a paper that we published in the journal Breastfeeding Medicine. What I think actually honestly we're seeing here is breastfeeding, because it's downregulating that stress response, I think it's actually attenuating the trauma effect. That's what I think. Okay, and we found this in every variable. Minutes to get to sleep, another very important sleep variable. The longer it takes for somebody to get to sleep, the higher her risk for depression. And again, you do definitely still see an effect of the sexual assault, but it is significantly less. And 25 minutes, we talked about this in kind of a previous module, 25 minutes is the group that you're really worried about in terms of risk for depression. Okay, and that we've seen that in about 5 studies now. It's amazing how consistent that finding is. But, it's just amazing, to take a look. You're at 24 here versus you're at about 27 here. Okay, also, how do they describe their overall physical health? Okay, again, significantly better. Their daily energy, and again, I think part of that's because they're sleeping better. Okay, and so what are the impact on her mental health? Now, remember the child abuse finding, which I think was actually really interesting. But take a look at this. And again, like I said, one of the things that breastfeeding is kind of known for is giving mothers kind of a little bit of a chill factor. Okay, so you can actually see that here. The breastfeeding mothers, look at this. Their anger and irritability is almost exactly the same between the non-assaulted and the assaulted group. But take a look at it up here. If you're not doing that exclusive breastfeeding, the exclusive breastfeeding does seem to, give you that kind of chill factor. And if you're not, you're more likely to be angry. And so can we extrapolate that in terms of, possibly increasing the risk for, abuse? And again, the vast majority are not going to be abusive, but, isn't it kind of nice that, in some ways nature gives us a little bit of a do-over? You see a very similar effect for anxiety and also depression. Depression was actually significantly higher, and we looked at depression a lot of different ways. This particular measure, we used actually the PHQ-2, which is a 2-item screening item for depression, but we also used the Edinburgh postnatal depression scale, and so we found the same thing. So anyway, that's actually in conclusion, just like to kind of point out that breastfeeding actually is protective of mothers because it improves their sleep quality, total sleep hours, minutes to fall asleep, and it also seems to attenuate the effect of trauma. And I really honestly believe that that is not just psychosocial, I think that that is also physiological. Okay, and it also seems to help because it decreases trauma-related sleep problems. And again, as any mother can tell you, it makes a huge difference. Even if you can get that 1 4-hour stretch as a new mother, it makes all the difference in the world. And so think about that night after night after night. And finally, I think because it upregulates oxytocin, it improves maternal well-being. And I think you see that reflected in a lot of the other variables we looked at. Okay, so with that, I'm going to actually wrap up this module. If you're interested in kind of knowing more about kind of the work that we do kind of on an ongoing basis, I would invite you to come and visit me on Facebook under Kathleen Kendall-Tackett. And also, too, if you're interested in knowing more about my work, these are my websites. A couple of ones I'd like to point out is if you're interested in kind of more about psychoneuroimmunology, I'd encourage you to take a look at Uppity Science Chick. But our Breastfeeding Made Simple site also has a lot of information and handouts and stuff you can actually use directly with mothers. But also, too, we can kind of talk a little bit about, the impact of abuse survivors, and we look at a lot of other kind of trauma issues. So anyway, with that, I'm going to wrap up. I'll see you next time. Thank you